Miss Lil, I like your new bandana. Happy Friday, Baylor College of Medicine and friends of Baylor. Well, my sister got sick over in January, and I kept insisting that she get tested for COVID, and it was negative. And I said, no, you don't know how to do it. Do it again. And it was negative again. And then all of her friends, and then all the people in the office got sick. And I kept saying, I don't know what's going on. Well, turns out, now we know. It turns out that over that period of time, early January and February, there was a huge spike. These are both antigen and PCR for human metapneumovirus. So what is human metapneumovirus? It's one that is really indistinguishable from the symptoms of COVID, except it really impacts not only older people, but young children as well. It was discovered in 2001 as part of the pneumoviridae family, which is related to respiratory syncytial virus. So it's very similar to that. And the symptoms, as I said, are really indistinguishable. Cough, fever, runny nose. Can be like a pneumonia. It's most active in late winter and early spring, and it can be transmitted through normal kind of respiratory transmission, but also contact. And so this is one that is more easily contracted by shaking hands or touching things where people have been infected. And the diagnosis is made by either PCR or by testing the antigen in a lysid assay. So that's what was going on. And now we know. We've made so many advances in the detection of viruses. We can sequence these that, in the past we go, oh, some sort of respiratory virus. But now we know it was metapneumovirus. So also in the news, there is a 5,000-mile mass of seaweed washing up on the Florida coast. It's sargassum is the name. It's not itself dangerous, but it's so large. It's got all kinds of junk trapped in it, plastics, jellyfish. Once it hits the beach, however, it begins to degrade and decompose, and it generates hydrogen sulfide and ammonia, so it smells like rotten eggs. So if you have asthma or some other respiratory disease, probably should stay away from it. No one knows why it went to Florida, but I suspect there was evidence of a Disney character, Merlin, hovering over that large mass, steering it to the Florida coast to welcome Governor DeSantis. Anyway, so some news on COVID. Not surprisingly, I love this. This is public health when it's not working right. Where is the biggest active place in the world right now? China. Huge spike, and this is mortality. Huge spike in mortality. So why? Well, the whole purpose, everything we went through with the lockdowns and trying to avoid contact, all those public health measures are intended to do a couple of things. One, to not overwhelm the health system, which we did pretty effectively. But secondly, you want to push off the disease until you find some other way to treat the public, like Paxlovid or some antiviral or vaccination. Well, the Chinese did the worst job. They locked everybody down, but they didn't vaccinate everybody. So then after they decide, well, the economy's got to boom, so we're not going to do that, they have a giant population of susceptible people. And the Sinovac wasn't very effective. Not many people got it. So they're like the hotbed of COVID-19 now. It's crazy. Very, very badly managed from both a social as well as a public health perspective. Now, we handled it better, but we did have 1.1 million people die. So we didn't do it great because while we pushed it off through closures, we didn't get the whole population vaccinated. Only about 60 to 70%. But hospitalizations continue to drop. The death rate is falling, so we're doing well. So that is why, in part, why the president declared the end of the public health emergency. So what does that actually mean? Well, what it means is vaccines still remain available, and the government will continue to distribute vaccines for free for now. So as long as there's vaccines available, you can still get them for free. What is no longer going to be free, however, are home tests. So home tests, if you recall, were free for everyone. And now they've distributed a bunch, and if you happen to have a pharmacy that has them, they may give them to you for free, but soon it'll be at the cost of the manufacturer. There is a CDC website that if you want to get free ones, it'll help you find. There's a finder. Paxlovid remains free for now until the current stocks run out. After that, it's going to be determined by the manufacturer and the pharmacy, so it'll be probably pretty expensive. And the only other thing is reporting of data is now different. They're not reporting case levels, et cetera, or sort of infectious rates around the country, but we're hoping that they continue to do wastewater analysis. Now here in Texas, we established what's called TEPI, the Texas Epidemic Public Health Institute, that's led by Eric Borwinkle, the dean of the UT Public Health School, and it's powered by the Baylor College of Medicine doing the sequencing and detection. So we'll have pretty good surveillance. Texas will have good surveillance, and I hope that the rest of the country, the CDC, uses us as an example to expand surveillance nationwide. They are continuing to look at wastewater, and if you look at the wastewater data, red again is an increase of 100% or more in wastewater virus. Orange is an increase of 10 to 99%, and you can see 40% of the wastewater sites are reporting huge increases in virus. So we can declare it's over, but it's not over. So where is it? Well, here, the wastewater sites that in red are reporting viral detection. So pretty much the virus is all over the country. Now, if you look at where it's going up, rather than just being detected, in the last 15 days, it's in just a few selected sites. So mostly the Midwest, some on the Atlantic coast, here in Missouri, and also in Colorado. But the coast, the far coast, east and west coast, and actually the Gulf Coast, is not reporting a lot of virus. It's mostly in the center part of the country. So I wanted to catch up on my favorite outbreak. You know, I love this. The CDC had a big get-together, the Epidemic Intelligence Service, EIS, conference. I reported on this a couple of weeks ago. But they had an 1,800 in-person, along with 400 virtual attendees between April 24th and April 27th this year. So it was in a hotel room in Atlanta, Georgia, where the CDC is located. So this meeting includes all the EIS officers and staff from the CDC and state and local health departments. So if ever there's a group motivated to do epidemiology, it's this group. And so what happened on April 27th, at the end of the conference, several people notified the conference organizers that they had tested positive for SARS-CoV-2. So, you know, the EIS leaders who all attended worked with the Georgia Department of Public Health and did a survey. Now, if they don't respond to a survey, there's no hope for surveys, but they did respond. 80% of the participants at the meeting responded to the survey. And of those respondents, so most of the people, 13% reporting testing positive for SARS-CoV-2. Now, again, it shows you how incredibly transmissible this disease is. It's almost certainly the XBB variant. About half of the attendees had reported being infected before. So even though they had been infected, they still got it. And about half had no knowledge of a previous infection. And all of them, 99.4%, had at least one COVID vaccine dose. So they'd been vaccinated. Half of them had also gotten it. So the key here is what happened. Like, none were hospitalized. No one got severely ill. And the risk of infection turned out to be based on how long you were there. So you had a 70% greater chance of getting infected if you stayed for the whole conference. So it emphasizes a couple things. One is exposure. Obviously, the longer you're there, the more likely you are exposed. And the second thing is the importance of vaccination. Everybody's vaccinated. 13% of the attendees got it, and no one got hospitalized. So please, if you haven't gotten vaccinated, get vaccinated. So I want to end today with a bunch of shout-outs. First of all, Dr. Bhavika Kaul is one of the 11 physicians selected by the National Academy of Medicine for the 2023 class of the Scholars in Diagnostic Excellence. So they get to spend a year working on interesting approaches to diagnosis. It's an assistant professor of medicine at Baylor, a pulmonologist at the DeBakey VA, and she is a member of the Innovation in Quality, Effectiveness, and Safety, or IQUEST. In addition, Dr. Joshua Ribak, a molecular and cellular biologist at Baylor, has been selected as one of 15 national Searle Scholars. The program provides grants to universities and research centers to support independent research of exceptional young faculty in the biomedical sciences and chemistry, so congratulations to Dr. Ribak. In addition, we had 6 graduates of our DeBakey High School for health professions were selected into the 8-year Houston Pre-Medical Academy. That is, they get a BS and then an MD. They graduate from DeBakey, they enter the University of Houston, and they are accepted into the Baylor College of Medicine. And a special shout out to the Runke Family Foundation that just endowed this scholarship. And finally, I just want to give a giant shout out to the GI division in medicine, who is ranked in the top 10 in U.S. News & Report in their global ranking. So wonderful, lots of great success. We had a wonderful graduation last weekend. Have a wonderful weekend. I can't wait to see you next week.
Lily, how would you like to be a great dane?